Right, this is the Pulse here on Joy News. I can now take you live to the World Trade Center where the medical laboratory professionals are addressing the media.
But we are not surprised at all. Colleagues, below is the outcome of the meeting. The National Labour Commission has directed that the employers and the union should, one, take immediate steps to obtain the necessary financial mandate on the issues that are subject to negotiation. Two, ensure that an officer from the Ministry of Finance with authority to make decisions during negotiations attend this meeting. That not later than Wednesday, the 26th of June, 2024, the above meeting should be held and report to the National Labour Commission on Thursday, 27th June 2024 by 2:30 p.m. That the leadership of the Medical Laboratory Professional Workers Union take immediate steps to call off the strike. Having reviewed the above directive by the National Labour Commission at the National Executive Council meeting and other stakeholders meeting held between yesterday night and this morning with our labor consultant in attendance, we have resolved to put on hold the ongoing industrial action and further advise all members of the union to return to work at their various places of work by Monday, the 24th of June, 2024, to put their workplace in readiness for full operation on Tuesday, the 25th of June, 2024. Of course, we are very much aware that our work requires calibrations and preparations of the workplace environment. And for that matter, full operation might not be very effective on the Monday. But we are hopeful that on Tuesday, the workers can operate fully at their professional capacity. The union has also become aware that some facility managers and administrators have been deliberately victimizing and threatening some of the union members as a result of the industrial action. We take a very strong exception and advise those taking such actions should desist forthwith, failure of which will report their conduct to the National Labour Commission for redress. Finally, we want to appreciate the solidarity that exists between and among the union membership during the period of this industrial action. We also wish to unreservedly apologize to our cherished clients who suffered in any way during the industrial action and promise to continue to serve them to the best of our professional ability. Thank you. I'm Dr. Cephas Kofi Akoto, General Secretary. Okay. And my first vice can go. Yes. Yes. People have traveled and they may not be close to their workplace at the moment. And so if we issue such an order, okay. All right. We are very much aware that Saturday and Sunday are also part of our work because we are essential service providers. We run shift and some of our facilities operate on Saturdays and Sundays. But we are fully aware that our members have traveled to their home and may not be very close to the workplace to resume work immediately. And for that matter, we are appealing that they resume work by Monday. Those who have traveled can travel back to their workplaces and start operation from Monday and Tuesday.
So Monday, they should go to work.
They should go to work. Can come on Tuesday. Exactly.
Then run away because of the abusive actions on technology.
Biggie will do that. Maybe let it be.
That's one. Okay. Can you? I'm saying, if Sakwenya iso na yeni medical laboratory professionals across our country adin komo kakra enra no ye call Labor Commission and a Labor Commission the niyama gu kwemu when you are sorry between medical laboratory professional any fair wages and salary commission no or the baswano okay say any many me ya no omonya financial mandate every Ministry of Finance na yemfanye sa negotiation yi osaso kan say meeting we mu no yemfa obi a owo tumi a obet committee Ministry of Finance engineer sa meeting mu bi osaso share medical laboratory professionals say yen kwadwuma yen take steps a ye de be kwadwuma enimani ya we ni nyina no National Labour Commission osaso kan say meeting we no it was next week Wednesday yes our meeting here na Thursday the now what paper ya dey call Labour Commission no yembra na mbebone amande e was anya me ya odi atutu akwemu no ne santi ene neck regional chairman e wo Ghana ha nyina no ye shae any stakeholders nyina ya din komo yie na akoba se say no ye striker ye di two akwemu no ye betwentwen so kakra enye say ye yi afri okra o ba ye twentwen so kakra na ye di ahwe ade senior niama ebekọ no enti ne santi ye gitum say ye nwan mu bi no omu fa striker akwenya isu etutu akwan kakra enti dia ye kan say by Monday 24th June there one more mutu kwan nyina omunye sure say ombeba abedru adwuma mu ye adwuma isu ni fapim agina work environment organization any calibrations ni apparatus e bi mu be ye fini ade mumfa we mu nyina ntutu akwan mu ye se na be ya benada de ye be start full operations enti ye be fa sa akwanya isu na ya to managers full one more mu the various hospitals no your cost strike say ebinumu out of frustrations no omu share yankrofo no bi eyomu ayakayaka de yekotu ebinumu krafi omu dan omu timu omu position omu wo yekogifri wo mu nsem yebefa sa akwanya isu na yato omufu say mra wo mayimu weka bia wo hu kwan say odeni hudum union na say union so wo right say obeko strike there and the omusu was right no say omu beye strike bi enti saa de course no say entwa yie say ye hu bibi saa ye de saa nipa no bekọ akọgina National Labour Commission no omu aka na sem senior say afesu mefa saa kwanya isu na me di achopa ama Ghana fo nyina ye strike sabi obiti ni baby onim say financial clearance bi ni homa medical laboratory professional but your cost strike ebi kokano obi ahwe ni nkwa chopper na yedi Ghana for na mum ye nyina ye hu se Ghana for lab for so ye nipa enti ye adwuma no mu nyina mu nkamu bi maye na next time ankoba se ye de yaka de ebetu wo saa.
Right, so the good news this afternoon is that the members of the medical laboratory professionals, they've suspended their strike at least for now, and they've called on their members to resume work on Tuesday. This decision they've taken is as a result of the meeting they had with the National Labour Commission and the Fair Wages and Salaries Commission. They say that they are respecting the directive that the Fair Wages, the National Labour Commission communicated to them. For that reason, the National Executive Committee met and took this decision. So on Tuesday, all their members will be back at work, and then their full operations will resume. subject to government meeting their demands, which is still a matter of negotiation that is still ongoing between them and the Fair Wages and Salaries Commission. When we have further development of this matter, we'll bring it to you. But for now, yesterday, the Ghana Statistical Service released a report which told us that as many as 7.3 million people in Ghana face poverty and lacking or have no access to healthcare, employment, education, and some live in very poor conditions. Unemployment contributes the most to multidimensional poverty index at 32.6%, followed by poor living conditions, poor access to healthcare, and lack of education. Kofi Ajay joins me to help us break down this report that was released by the Ghana Statistical Service this morning. Kofi, so what has pushed a lot of people into poverty?
Well, for this measurement of poverty, it's not measuring the money in your pocket, but just like you said, for you to be described as multidimensionally poor, it means you must be deprived of the indicators you mentioned. So we are talking about healthcare, education, employment, and then you're looking at your living standards. Okay. And for me, the most important aspect is the healthcare and the living standard. Okay. Then you can also talk about employment and even education. Because with your living standard, they looked at whether you have access to toilet facilities, water, and food before you even come to education and healthcare. Now, this is not a new survey entirely. This is a pure analysis from the 2021 population and housing census data that the Ghana Statistical Service, collected in 2021. So they are basing on this to make some of this analysis for us to know when it comes to multi-dimensional poverty, what is the true state of the country. So it's not measuring the money in your pocket.
All right. Kofi, I'd like to hold it there. Let me take our viewers back to the World Trade Center, where my colleague Papani Ashale is engaging the General Secretary of the Medical Laboratory Professionals.
Where a few minutes ago, the lab technicians have made a decision, or lab scientists, I beg your pardon, have come to a decision as to the way forward on their strike. Yesterday, Thursday, they met the National Labour Commission together with some government representatives, and there was an order for them to consider calling off their strike. Well, they didn't exactly call that off. I have the General Secretary of the union here with me, Dr. Cephas Akoto, and he will walk us through exactly the decision that they took once again. Cephas, thank you very much for doing this with us.
Pleasure.
Great. So, Cephas, the order from the NLC was to call off the strike, but the terminology changed when you gave your press just a few minutes ago.
It depends on how you want to interpret it. But for us, we believe we are law-abiding. And so whatever decision or directive the National Labour Commission has given, our decision here is to reflect that decision. And for that matter, we are putting it on hold. At any point we still feel aggrieved and that our concerns are not being addressed, we will reactivate the strike action.
Okay, so you use the word you are putting it on hold.
It's on hold.
So you are suspended it temporarily.
Whether it's called off, we still have the right to revisit it. Okay. And for that matter, at any point in time, we feel shortchanged, we are going to reactivate the strike. Interesting.
So you have between today and Monday to resume work. I heard you say that they should resume on Monday, but people are waiting for the pregnant women in queues. There are people with cancer that are waiting for your direction to doctors as to what to do at the moment. Why Monday? That's 48 hours from now.
The truth is, the day is almost over. People have traveled to their various villages and homes, and they may not be close to where they work. And for that matter, we cannot say that immediately they should resume work. And the work itself...
But that's exactly what you did. Immediately you called a strike.
Yes,
so it would just be fair that immediately you resume work.
Of course, the strike is on hold. But then we have given time that by that time, if nobody has, if the worker has not resumed work, management within today, tomorrow, and Sunday cannot take any disciplinary action against such a member.
Are you not being insensitive at the moment?
We are sensitive. Let me tell you, we are law-abiding. And in fact, the decision to put the strike on hold is just in the interest of the patient. Because as I tell you, we have embarked on strike for how many days now? Till now, Fair Wages and Salaries Commission has never seen the reason to invite us for any engagement. Even the Ministry of Health has failed to engage the union till now. But for us, we can see what our clients are going through, and we cannot be insensitive. And ourselves, we are not immune to strike action. And so we are putting it on hold, giving them the opportunity to rethink. And if they fail to act, we will go back to their decision.
Great. We've been to almost any major hospital across the country. It appears that there's a backlog of work that is waiting for your members to attend to. For those who couldn't wait, they managed to go to private centers. But I'm sure when they hear this news, they'll all run back to where it's cheaper and affordable. I mean, how do you intend to deal with this backlog of work that you have to do?
That is the difficulty we have to face. We know that the work we do, nobody else will do that. Any backlog that is available is going to put pressure on us anyway, but it's a necessary decision to embark on this exercise. I can tell you for a fact that some facilities think they can run without the laboratory. And as we speak, cardiothoracic center cannot run. Foreign clients that have come from Kenya and other places are still there, waiting for the laboratory before they can continue. You heard in the media that Mencha Hospital suspended a theater and other surgeries. It is not the only facility that has suspended their operations. Major facilities in the country have suspended surgeries because without a laboratory giving you results, you can't go to the theater.
But again, I'm asking, we know how important and crucial work that you do for the medical space, the health space. How do you intend as a union to deal with the backlog? Because if ordinarily you were treating 100 people a day, now you have a backlog of 500 people plus Saturday and Sunday, you are talking about 700 cases to deal with. How do you intend as a union to deal with that backlog? Simply, are you going to work overtime or put in special measures so that you can clear this backlog?
Simply, it's going to put pressure on us. We know lives are involved. So where there is the need to prioritize, we will do that. And we'll put plans in place depending on, because it's not the same case across. Some facilities may have high workload, some may not even have any at all. So the lab management at that level, they know what they have to do to clear the backlog.
Okay, great. We'll come to what you expect from the meeting that you are supposed to go before Thursday. Now let's talk about one concern you've raised throughout your strike, that some of your members are being harassed across the country. I mean, this will be the third time I'm hearing this from your union. Specifically though, what is happening where that you can point to that you think that some of your members have been treated unfairly whilst you're on industrial action?
For instance, we have a member who has been asked to vacate his accommodation simply because he has embarked on industrial action. We have members who are laboratory managers, and these people have been relieved of their position simply because they could not keep their members at post. We have colleagues whose positions have been taken from them. Some of our members who are casuals, management at that facility level has terminated their appointment just because these people have gone on an industrial action to press home their demand. I can tell you for a fact that we are not even going to leave that to happen. The casuals that they are maltreating or mistreating, some of them have been working for 20 years for a job that is continuously available. And every 3 months, management will terminate their appointment and renew. If they are not needed, why do you keep them at post for almost 20 years?
Safas, listening to you, I'm doubting the message that you are putting across that some of your people are being harassed elsewhere. You haven't given me a specific example where this happened. You mentioned about people who keys have been taken from the others have been asked to vacate their office. Where specifically this happened? Because these are things you've also promised that you're going to take to the National Labour Commission.
I can tell you, Pong, for instance, a member there has been asked to vacate his accommodation. If you go to Holy Family Hospital in Techiman, people have been threatened that their appointment will be terminated. When you go to Holy Family Hospital at Nkoko, management at that place has declared positions vacant. And Faith Mission. And in fact, the list is there. If you want me to furnish you, I'll give you. But the point is that it is not also good to put the names of this facility out there without engaging with them. And so for us, it will be proper that we rather visit the management at that level to understand their challenge. Because the exercise we have embarked on was a legal one. It was their right to do so. So under normal circumstances, management should rather be speaking for these people instead of taking legal or, let me say, disciplinary actions against them.
Great. Let's come to your expectations from the meeting that you are expecting to have with government, especially Fair Wages and Salary Commission. What really, again, going to that meeting, what are your expectations for that meeting?
We know this meeting is supposed to be a negotiation meeting. And at negotiation, you don't get everything. So as a union, we practice interest-based negotiation. We have genuine concerns over the demands we are putting before the employer. When we meet the employer should be able to tell us their difficulty, and we meet each other halfway. But the situation where the employer will take an entrenched position, and if the union also take an entrenched position, for instance, we have compromised to call off our strike just because we feel the plight of our clients. Management has not taken any step to address any of our concerns, but we have seen what our clients are going through. And as humans and law-abiding people, we want to go in the direction of the National Labour Commission, putting all our faith and trust in their authority. Should they fail us beyond this period, we will know what to do.
Sure. I'm really grateful to you. So that's the General Secretary of the lab scientists you just spoke to. And you just heard from Cephas, Dr. Cephas Akoto here. He says that, well, they have hope in this particular negotiation. They've been given 5 days between now and Thursday to negotiate with government, specifically the Fair Wages and Salaries Commission. They are hopeful that it will become fruitful. We just heard from them that they're also willing to take up institutions that have been harassing their membership over the time period where they have been on an industrial action. Well, there's more that we'll see from this particular action. But for now, the union says they have put their industrial action on hold, suspended, but not called off entirely, and will be reactivated if these negotiations don't go as planned. Well, Alton, this is what exactly we can report from the World Trade Center, where they've been holding a press conference on the way forward of their strike.
Well, thank you very much. That's our correspondent, Michael Ashali. And the news this afternoon is that the laboratory professionals, they are back at work, but you'll see them on Tuesday. They've suspended their strike, and they will resume work on Tuesday. And they have other concerns. The government is hoping that by Thursday, they will deal with all these matters so that their issue of conditions of service will be resolved. There will be some finality to the matter. So on Tuesday, expect them to be at their desks at the various hospitals as they offer their services to the public.